Are bone spurs related to rotator cuff tears? Have you ever wondered how bone spurs might connect to rotator cuff tears? This is a common concern, especially for athletes and those in sports careers. Let's break this down. Bone spurs, also known as osteophytes, are bony growths that can develop on the bones in the shoulder joint. They often form under the acromion, which is a part of the shoulder blade. When these spurs develop, they can narrow the space where the rotator cuff tendons pass. This can lead to irritation and damage over time. The rotator cuff is a group of muscles and tendons that stabilize the shoulder and allow for a wide range of motion. When a bone spur forms in the subacromial space, which is the area beneath the acromion, it can pinch or rub against the rotator cuff tendons. This friction can cause the tendons to become frayed, irritated, and inflamed. If this continues, it can lead to partial or full-thickness tears of the rotator cuff. Research indicates that certain types of bone spurs are more closely linked to specific types of rotator cuff tears. For example, heel spurs are often associated with tears on the outer surface of the rotator cuff tendons. In contrast, traction spurs are linked to tears on the inner surface of the tendons. Athletes who perform repetitive overhead activities, such as baseball players, swimmers, and tennis players, are at a higher risk for developing bone spurs and subsequent rotator cuff injuries. Understanding this relationship is important for athletic trainers and sports medicine professionals. Identifying and managing bone spurs early can help prevent rotator cuff tears or lessen their severity. Treatment options for bone spurs related to rotator cuff tears include modifying activities to reduce overhead movements, physical therapy to strengthen shoulder muscles, and anti-inflammatory medications to alleviate pain. In some cases, if conservative treatments do not work, surgical removal of bone spurs may be necessary. Athletic trainers should be aware of the signs of bone spur-related rotator cuff injuries. Symptoms can include shoulder pain, weakness, limited range of motion, and a popping sensation in the joint. Implementing proper training techniques and conditioning can help reduce the risk of these injuries in athletes. In summary, bone spurs can lead to mechanical irritation of the rotator cuff tendons, resulting in tears, especially in those engaged in repetitive overhead activities. Athletic professionals play a vital role in managing these injuries to support recovery and maintain athletic performance.